which is completely taken out. Only bronchial trees are left, the duct system. Okay, right? These are called as bronchioles. Up to the terminal bronchioles we are there. That is taken out. Here one lung, this is another lung. In between two lungs, there is a space occupied by this. This is the heart. Can you see this? Okay, now completely what you're seeing, this is the costal surface of the lung. Okay, the pleura which is covering here, the pleura is not here. Okay, pleura is not here. What pleura you're expecting outside? It is taken out. That is parietal. Okay, what pleura you're expecting here on the whitish thing you're seeing? It is thickly adherent. You can scratch it like this. Come on, but don't do it. Okay, that is the visceral pleura. Okay, are you understanding? So now the pleura which is covering this is called as costal pleura. The viscera which is covering, look at, this is the point where you can see this. It is going towards the neck. The part of the lung tissue is going above. This is called as apex. Apex which is towards the neck, that is called as cervical pleura. Covering. Okay, whatever the pleura it is covering here. Can you see this? Complete the whole length. I'm going to make it. This is the sternum. I'm going to clear this completely. It is going towards the vertebral column. Can you see this? This is called as medial surface of the lung. It is the pleura which is covering the medial surface. It's called as mediastinal pleura. One of the beautiful here you can see here. Okay, it is. This is the surface which is sitting on the diaphragm. This is the diaphragm. Can you see this? Yes, this is the diaphragm. The surface which is covered by this pleura, this diaphragm, that is called as diaphragmatic pleura. Is that clear? Costal pleura, mediastinal pleura, cervical pleura, diaphragmatic pleura. That is how exactly. Now the pleural cavity. The pleural cavity. One more important thing. Okay. When you're putting the fingers, see, can you see this? This is the axillary line. I'm putting the, okay, completely. I'm piercing it. It's going deeper. It is going deeper. Can you see this? Can you see this space here? Okay. That is the space what is known as costodiaphragmatic recess. That means, you know what is the recess? Is completely. Yes. 1 second. I'll show you. Diaphragm. You're seeing there, right? So now I'm talking about the pleura. The pleura which is covering here. That is, this is you're seeing. What you're seeing. This is a cut section of the ribs. You're seeing. Can you see that? Yes or no? Yep. Exactly what you are seeing. I'm writing this line. You can see the costal cartilages. In between there is a intercostal muscles. In between there is a intercostal muscles. Same diagram I'm writing. All right. Now I'm talking about this. What is this surface is covered by what pleura? Parietal. Again I'm repeating, don't worry. The parietal pleura. Parietal pleura comes like this. Okay, it is going downwards like this. And again, what is the pleura covering here? The diaphragm. Diaphragmatic. This is the diaphragmatic pleura. It is coming like this. It is covering, and they both join here, something here. Okay? Can you look at the space between this costal pleura and the diaphragmatic pleura? I will label it so that it is easy for you. What is the pleura covering here? What is the pleura covering here? Cervical. Okay, what is the pleura covering in the medial surface? What is this pleura? What is that? Yeah. Yes. Pleura. Okay. Now, what is this pleura? This is the costal pleura. Now, everything you're understanding. Okay, here. So look at this. This the costal pleura comes like this. It goes deeper. Okay, towards the 10th. Okay, or 11th rib. It is going. The diaphragmatic pleura comes like this. It's going at medial rib. Okay. Can you see the space between these two? Can you see this? This is called as costal diaphragmatic recess. Are you understanding? This is a very important. What is costodiaphragmatic recess? I will explain medically. Okay, it's a definition, medical definition. Costodiaphragmatic recess, it's a potential space between the pleura which is not occupied by the lung tissue, during normal quiet breathing. Understand? Understand. It's very, very simple, very simple. See here, it's a space between the pleura which is not occupied by the lungs during normal quiet breathing. You can ask me, sir, if I take a deep breath, what happens to this space? It will? Definitely, it will occupy, it will expel. Lung expands and completely this costodiaphragmatic recess disappears. That means this is the potential space. Okay, when you're standing supine, this is the most dependent part of the pleural cavity. Are you understanding? So any pathology, any problem in the lungs, any pathology, wherever the pathology, there will be a release of fluid. The fluid accumulation first and foremost takes place here in this costodiaphragmatic recess. That's why it is very, very important to know what is the recess means. It's a space where it is present in between the pleura. Okay, so more obvious we are going to see here. Which is the place? It is near to the diaphragm. It is going. See, this is on the lateral aspect. When you're putting the fingers, you can put that. See here, I'm going to put the fingers where you are going to see the costodiaphragmatic recess. Look at this way. I'm putting. Oh, that's a space. That's a space. This is what? Okay, this is where I am going to. Another important thing is that here, this is the right lung. A left lung, when you're taking it, having a cardiac notch. Okay, I'm going to show you. Cardiac notch will be there. Cardiac notch because of the heart. Okay, there also the costal pleura and the mediastinal pleura, they forms a space that is called as costomediastinal recess. That is not so important. Very importantly, this is the stick. Costodiaphragmatic recess. So make Salam alaikum. Two lungs. In between the two lungs, are you understanding, in the midline, whatever you're seeing the situation of the heart, completely from the sternum till the vertebral column, that space is known as mediastinum. What is that? Yes. Okay, today you have to identify, you have to understand what is the costal pleura, what is the cervical pleura, what is the mediastinal pleura, what is the diaphragmatic pleura, and you have to understand where is the situation of the costodiaphragmatic recess. That is also called as pleural recesses. Okay, pleural recess. What is recess? A space. It's a potential space. What is pleural recess? Can you define? It's a potential space between the pleura, okay, which is not occupied by the lung tissue during normal quiet breathing. If the person is taking a deep breathing, completely the lung tissue expands and completely disappearance of this recesses. Okay, in this there are two varieties of pleural recess. Number one is costodiaphragmatic, another one is on the left side costomediastinal recess, which is not important. But the situation is in the cardiac notch, I've already told you. But costodiaphragmatic recess is present bilaterally, right and left side. Are you understanding? Right? Okay, this is a very, very important that you have to see. This is the diaphragm. You are going to understand what exactly the situation of the diaphragm. You have to see today and understand what is the mediastinum. Okay, what is the mediastinum? What is the mediastinum is called between the two lungs, the central part. The space between the two lungs in the center, that is called as mediastinum. Alright, this is what you are going to observe here. So the ribs, actually, between the ribs you are going to see the intercostal muscles. You are going to see that. Completely thoracic cavity, I am going to demonstrate. Please, without making noise, you come there. Completely all the structure is removed. Okay, the lung. Okay, thank you. See here, what is this bone is called as sternum. Look at this bone is called as sternum. Can you see? This is the central axis. This is a central bone. This is called as. These are all the vertebrae. This is the vertebral end. This is the sternum. Okay. Completely look at the space here from anterior posture. That is at the center. Okay. This is the sternal angle. Okay. So whatever space you're seeing, this is the space is called as mediastinum. Okay, completely this is the middle part, the central part is the mediastinum. On the two sides, this is exactly the position of the thoracic cavity. What is it? Thoracic cavity. Thoracic cavity completely you can see here. And you can see, my dear students, can you observe here, in between these are all the costal, these are the ribs actually. In between the ribs, can you see the inferior, from the inferior border, you can see something is coming out, emerging out here. Wow, so beautiful. You can see here, you can see here, you can see here, you can see here. Can you see what are those? Yes, absolutely correct. Those are all the intercostal nerves. That is exactly, it is coming in relation to the inferior border. The structures are emerging out. You can identify. Those are all the intercostal nerves. The vessels are not so important here, and it is not seen here. Okay, intercostal nerve, intercostal spaces, intercostal muscles. You can see, you can't see the muscles three separately here because it is completely attached. All right, so that's the one thing you have to remember here, the intercostal spaces, how beautifully the intercostal nerves are coming out. You have to observe and understand this. Okay, so one of the important nerves you have to observe here on either side. This is the one nerve. I'm not going to repeat, this is the one nerve, see here. And you can also observe here, this is the another side nerve. Can you see this nerve here? Okay, just come here. You come here. You come here. You come here, you stand that side, see here, look at this nerve, hold this, now do it, just do it, look at this nerve, where it is going and gets attached. No, you tell me, like, no problem, whatever you're seeing there, that's absolutely, you can find also same thing, that side nerve. Dear doctor, can you just see what it is piercing? It's piercing what? Don't take. It is going and piercing what? Absolutely. What about that? Yes, you see? Yes. So what you are seeing, you tell me. Don't be afraid. I'm not asking you a question. Okay, right? Okay, this is the bilateral it is present. That means the nerve which is piercing the diaphragm, the nerve which is giving the branches to the diaphragm. That means it should be bilateral. You can see the phrenic nerve. What is the nerve? Yes, the whole lifetime, never ever forget the phrenic nerve. That is the nerve which supplies the diaphragm. If there is any injury to the phrenic nerve, diaphragm fails to contract and there will be respiratory distress or respiratory problem. Is that clear? So, to identify the phrenic nerve, you have to identify bilateral it is present and identify the intercostal spaces, identify the intercostal nerves here, okay, identify and see the space. So beautifully you can see from this side, this is the view, lateral view. From behind this sternum, you are going to see the spaces till up to the level of the vertebral column. You can see this, that is the space is called as mediastinum. You try to understand, right? You have to, like you can see the bilaterally how the dome of this particular important, it is called as fasciomuscular sheath, that is called as diaphragm. Understand this diaphragm. I'm going to ask you a question. See here, my dear students, I'm going to put the probe here, Oh, it's a potential space is going there. What is the space is called as? Rhesus, absolutely correct. Absolutely correct. Bilateral it is present, that is where you are going to see, that is the costodiaphragmatic recess. Okay, that's the recess. What is the pleural recesses? Pleural recess is nothing but it's a potential space between the pleura, okay, potential space which is not occupied by the lung tissue during normal quiet breathing. When the individual takes a deep breathing, lung tissue expands and completely it occupies the space. Okay, it's a potential space and it's a more dependent part. Okay, whatever the lung pathology, the accumulation of the fluid or accumulation of the blood, whatever the accumulation, it's going to take place where? Which is the first is it's going to take place in the costodiaphragmatic recess. Whenever you take an X-ray, whenever there's a problem, first you're going to identify, something problem in the costodiaphragmatic recess. That means some fluid is accumulated there. You're not going to see. That radiology I will teach you. That's the NBMB question on you 1000%, not even 99 or 100. It is 1000%. Question will be there. So you have to focus when I'm teaching these X-rays. You should focus. Okay, there I am going to give a clue and the questions. Is that clear? Now I am going to teach you the features of the typical thoracic vertebrae. Must know things for the undergraduates, and you must know because of in the Viva I am going to ask you the parts. Okay, identification of the parts. I am going to give you all the thoracic vertebrae identification. Okay, I am going to teach you another 5 minutes. After that, remaining part is completely you have to go around, see. Whatever it is, how many? I'm not going to ask whether it belongs to T3, T4, T5. No, all the features will be same. Only the classification. I'll ask you what are the other atypical. Okay, right? If you tell T11 and T12 is atypical, I'll be happy and I'll leave you. Don't okay? So typical, like usually I'll ask the parts, okay, for it and adapt position and everything. The first and foremost thing is see here. So this is the body of the thoracic vertebrae. This is the body of the thoracic vertebrae which should face forwards. Which should face forwards. The bony projection like a spine, like a sharp, okay, projection of the bone. It is called a spinous process. It should face backwards. Okay, are you understanding? The body of the vertebrae should face forwards. The spinous process should face backwards. This is very, very important to hold it in anatomical position. Is that clear? Right? Yes. Always remember the spinous process should face backwards and downwards towards the floor. Okay? I will catch like this. See here, this is correct. Now the spinous process is upwards. It is going towards the head. That is wrong. Then immediately you have to turn back. Are you understand? Right? That's the one thing. Now I'm going to write. This is absolutely. I'm going to write. This is the anterior aspect. This is exactly what you're seeing. Okay. This is. I'm going to enlarge the diagram so that you will understand. So like this. Yes. You're going to see. This is absolutely called as the body. Okay, when you observe the body, the anterior-posterior diameter and the transverse diameter is almost equal. Almost equal. Are you getting my point? Yes, anterior-posterior diameter and the transverse diameter is almost equal. Okay, that's our point number one. And then after observing this is the body of the thoracic vertebrae. Okay, some of the books they have given it is a heart shaped. Yes. Okay, some of the books it is given in heart shape. That's fine. That's, I don't talk about the shape way. Okay, according to me. Okay, now it is the anterior part in the body. You understood now the body behind. If you go to the body, you are going to see a piece of bones like this, which is attached to the body on backwards and the posterior aspect. You are going to see the backwards. There is a bar of the bone. This piece of the bone, okay, this piece of the bone that is called as anybody pedicle. Okay, pedicle. Okay, that's the one thing. That's the one thing. Next, this pedicle above and the below, there is a elevation of the bones like this. Okay, elevation above and one elevation below. These are called as superior articular facet, and this is called as inferior articular facet. One is above, one is below. One is above, one is below. You have to identify this. This is a very, very important. Okay, this is the superior articular facet. This will be the inferior articular facets. Okay, fine. Okay, now immediately just lateral to the superior articular facet and the inferior articular facet junction, there is a important. There is one important extension of the bone, like a chocolate bar. You're going to see like this. You're going to see like this the extension. These extensions of this called as transverse processes. Transverse process. Okay, transverse process. We are going to see the transverse process here, right? Okay, then after transverse process, okay, now the transverse process is over. Now, with junction between the transverse process, okay, this is the transverse process here, and the superior articular facets behind, you are going to see two plates of bones descending downwards like this. Okay, these plates of bones is called as lamina. Two lamina join at the center, and continues like this and forms what is known as spinous process. Spinous process. Now, between the body and the lamina and the pedicle, there is a circular opening. What is this opening? Is called as? Yes. What foramen?
Vertebral foramen.
It is also called as vertebral canal. What passes through this? Spinal cord and its coverings. Okay, this is absolutely one of the important things. When you are holding in anatomical position, you can see on the lateral aspect, where I am going to write the body in the lateral aspect like this. Okay, these are all the spinous process like this. Okay, this is the lateral aspect I am showing you. This is how exactly it looks like. Okay, so on the lateral aspect, if you are seeing, this is the superior articular facet, this is the inferior articular facet. Now, on the body, you are going to observe there are the two important facets, here one and here one. Okay, these are called as demifacets. Demifacets. You have to observe here and above, upper and above and below, superiorly and inferiorly. On the posterior aspect, just behind or in front of the superior articular facet and the inferior articular facet, you are going to see the two important facets, the half facet, that is called as demifacets. Now, what are the parts? See here, what is this? Body, vertebral canal. What is this piece? Pedicles. What is this? Superior articular facet. What are these? Inferior articular facets. Now, what is this? Transverse process. Transverse process continues like a plate of lamina. What is this? Spinous process. And this is the superior and inferior demifacets. Finish. All these things you must know, you must learn, and the ribs who have not seen. Okay, what is the head, neck, and tubercle? Identification is a very important in the rib. Okay, please take the typical rib and study those things. These are all the important practical points you have to learn today and till the hall. That's it. Afternoon, I am going to take the theory class. Continuation. Biochemistry is not